you're welcome to my channel back again. And please, if you're a returning subscriber, I heart you so much. I really appreciate. And if you've not subscribed to my channel, please, I will urge you to do so. You might be learning one or two things. Thank you all for joining. Now, I would really want to talk about diabetes, the current state and the current treatment of diabetes. Diabetes type 2 actually. Diabetes type 2 is also known as adult onset diabetes. But the name is gradually changing from adult onset diabetes because it is now evident in children. Yes, it is now evident in much younger children, children that are under 9 years old. Yes, all over the world, it is estimated that most children under 9 years are now exposed to diabetes type 2. And I assure you that wherever you are, and if you have the type 2 diabetes, I'm assuring you today that you can live a normal life. And I want you to understand that medications is not only the thing that can actually help in the management of diabetes type 2. They have 4 major treatments of most nutritional related diseases, not just diabetes. We have diet administration, we have drug administration, we have physical fitness, and we have education. What I am doing now is actually one of them, which is education. When you are able to know about diabetes, you'll be able to control it. Now, if you meet a doctor or your physician that is managing your condition, it is required that you put in some work. Which work do you need to put in? Put in a work in maintaining a good nutrition. You should take the way you eat seriously, because it is estimated also that type 2 diabetes is highly related to diet. So the way you eat, the way you plan your meal, you should look into it. And your meal should be well planned. Yes, so that you don't go overboard eating foods that are likely to higher your blood sugar level. When your blood sugar level increases, it can predispose you to so many other conditions, not just diabetes. It can also predispose you to complications of diabetes. And you and I know that we have so many unbecoming complications of diabetes, such as blindness, yes, retinopathy, diabetic retinopathy. It can lead, this is a condition, this is a complicated condition of diabetes whereby the individual is likely to go blind. Then we also have kidney failure, nephropathy, whereby the nephrons, that's your kidney cells, are gradually being destroyed. And I don't want to bore you with so many other terminologies that you might not really understand, but I would like you to know that when this condition, diabetes type 2, is not controlled, it can lead to so many other complications. So that is the reason why it's very necessary that you take what you eat consciously, intentionally. Don't just eat anyhow, and you will live a better life. It will also help you avoid other complications, other nutritional related diseases such as cancer and all that. So there is this sweetener that I want to recommend to diabetics, and it is called dates. Yes, dates is one of the sweetener any diabetic can take advantage of. You know one thing unique about dates? Dates contains a lot of antioxidants and is also rich in fiber, and it has low glycemic index. Yes, low glycemic index in a layman's language is the rate of the amount of sugar in it are not likely to predispose you to hyperglycemia. That is the condition whereby your sugar is quite higher than normal. So it is actually very, 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 very important that you take your nutrition seriously. Also, I would also recommend that you also eat your garden egg leaves, your garden egg fruits, your garden egg fruits, and your cucumber. You should always snack on them. They will help provide the adequate amount of fiber that you need as a diabetic, a healthy form of fiber. In my next video, I'll be listing all the foods you should take personally as a diabetic. So, like I said, date is a natural sweetener. You can take advantage of your dates. Yes, date is a wonderful sweetener you can always choose anytime. Taking 2 to 3 servings won't hurt. Yes, you can actually add it in varieties of your food. You can add it in your pap. You can snack on it. 2 to 3 servings won't hurt. Also, it is required that you keep a close watch. You should always monitor your blood sugar level by always testing. Yes. You can always test it with your glucometer, or you can go any nearby pharmaceutical shop and check it at some time, and you're living your normal life as a diabetic. Yes. Another thing I would like us to understand is this. If you are diabetic or you know somebody that is diabetic, diabetes is not a death sentence. Yes. Whenever you eat a particular kind of food, you shouldn't take it that this food is likely to spike your blood sugar level. Another thing that can actually increase your risk of, having a higher amount of blood sugar level whenever you check it is also your physical activity. How do you exercise? What sort of work do you do? Are you a sedentary worker? Do you just sit at home? Don't you move about? These are the questions you should ask yourself. Your level of physical activity is likely to affect your level of blood sugar level, your blood sugar level at that point that you've checked it. Yes. Another thing is your insulin sensitivity at that point. Diabetes is just not because your sugar is high. It's majorly because your insulin level is depreciated. Your insulin sensitivity is depreciated, or the amount of insulin you have is not viable enough, or that you don't even have at all, which is that of type 1. Yes. So type 2, which is highly related to diet, is as a result that the insulin level is low, or the amount that you have is incapacitated. Yes, is almost like is not useful to you. And the job of your insulin is to regulate your blood sugar level, is to tell the blood that is flowing in your bloodstream what to do. Is just to send them messages. So that is the one of the major work your insulin does. So when they are absent, or when they are not, when the amount is not there, when the required amount is not there, it is likely to cause a lot of problem in your body. So that is why you are administered some medications. You are given insulin as well as hyperglycemic drugs. But these medications will not ascertain your health. It will not help you achieve a sound health as a diabetic. What will help you achieve all that is when you are able to join it with a sound nutrition. When you are able to be conscious of the kind of food you eat and how, and even when you eat it, it will help you achieve a better life and a better health. So, I would urge you guys to please, if you have any diabetic around you, encourage the person. If you have a sound knowledge of what you can do to help that person live a normal life, please, I encourage you to do so. Also, mothers who are predisposed to gestational diabetes, the pregnant women, yes, you also have a higher risk of developing diabetes in the future. You know, when you put to bed, the condition elapses, but it also shows that you have a higher chance of developing diabetes in the future. So this is actually like a revelation to you, or a call to order to you, for you to take it easy. Check the kind of food you eat, check when you eat it, and check how you eat it. It will help you adjust. It will help you to be able to know how to modify your diet. Yeah, thank you very much. Like I said, if you've not subscribed to my channel, please always do so. And turn on your notification on so you get all the messages that I'm going to be dropping and all the videos I'll be dropping in the next future. So you will always, get in touch. Thank you very much. Bye for now.